Look out to that waiting room. There are sicker people than you. You're wasting my time. These 3 statements were said more than once over a 12-month period as my dad visited various doctors to address debilitating symptoms that would eventually threaten his life. My dad was a hardworking entrepreneur. He shared a business with my mom. They were partners in life and work, and they were married for over 25 years. My dad was the coach for most of the teams we played on. And when any of us were in a school production or a dance recital, when we came on the stage, no matter how small or big the role, my dad would stand up and wave enthusiastically until he got our attention. As a kid, it was truly embarrassing. But I look back on it now and I realize that my dad was trying to tell us something. That he was always with us, that he was always our biggest fan, and that he was always cheering us on. My parents were active in their life, work, and school and community, and I can't remember either one of them missing a day of work due to sickness until 2002. My dad's symptoms of stomach pain, nausea, indigestion, and fatigue, they started to become debilitating. We watched a man full of life and energy who had a passion for food and celebration. He eventually got to the point where he could no longer eat. It was clear to all of us who loved and cared for him that something was terribly, terribly wrong. The challenge, the medical experts whom he reached out to did not agree. After multiple visits to the doctors, all of those test results, they came back normal. But my dad learned about a test that he had not yet received, and that an urgent referral was possible, but he needed the support of his family doctor. When he made that appointment and asked for that referral, the doctor issued those 3 statements. Look out to the waiting room. There are sicker people than you. You're wasting my time. My dad left that office with feelings of guilt. He was worried. He started questioning his symptoms. Perhaps he was a burden to that doctor, that whole healthcare system. He had a fear that day that someone else needed that appointment more than him. We don't often talk about the stigma of asking for help in this context. But like my dad 20 years ago, seeking out medical support, there's often a judgment, a mistrust, even a criminalization of people looking for help. In my experience, people won't openly admit that they don't trust people. But when we engage in conversations about hunger, homelessness, and poverty, it feels like mistrust floats to the surface of conversations. When we ask questions like, well, how many people are really that hungry? Who are these people anyways? We disguise our mistrust behind a need to be driven by data, pie charts, and bar graphs to determine who needs help, or perhaps more accurately, who's earned it. Most recently, I was in a meeting with the BC Family Physician of the Year, Dr. Karen Kowski. She looked at us all in this meeting one day and she said, when people are asking for mental health services, no one is ever an inappropriate referral. No one should ever be considered out of scope. We need to remember all of these pieces of paper, these numbers, these referrals, they're real people. Today, I work for Whistler Community Services Society, a social caring agency full of dedicated staff and volunteers supporting people in the areas of mental health, hunger, and hardship on the unceded territory of the Squamish Nation and Lillooet Nation, what is known as Whistler. My dad's experience more than 20 years ago completely gravitated me to nonprofit social caring work, only to discover that he was not alone in the stigma he faced in asking for help. Don't get me wrong, data is so crucial in our development of important community services and programs, but it needs to start with this common goal to empathize and learn and listen from people seeking help. Statements of mistrust, othering, it just makes this whole issue feel even more disconnected. It exacerbates problems that feel hopeless. It's not a lack of money, people power, or capacity that make most issues like hunger, homelessness, and poverty unsolvable. It's our mindset of mistrust, othering, and disconnectedness. In all of my years in collecting data about hunger, homelessness, and poverty, I've learned that these people, they're no different than any of us. I've learned these people, they're all of us. My coworkers and I can share countless stories of people who worry that they are a burden when asking for help. Our staff at our social enterprises and thrift stores, they help people who've lost everything in a devastating fire or flood. Our food bank team watches on as a newly single parent fills her basket with food. Our administration and social service team watch people nervous and anxious who don't have an appointment, only to know that they are exactly in that moment where they're meant to be. I can remember a night when we opened an emergency weather shelter. It was minus 20 degrees or colder outside, Celsius. And I watched this man enter the shelter. Despite his small frame and few belongings, he looked like he was carrying this very, very heavy burden. As I went to go dim the lights at the shelter, I saw him motion and ask me to come over. As I approached him, he said, "I notice you only have 6 cots here tonight, and I'm worried. I'm worried that I could be taking away a cot from somebody who really needs it." This man was living outside in a broken down truck with no space heater, working in the community, unable to pay for rent, and he was worried that someone needed that bed more than him. Despite being safely housed, warm, and thankful, these were the thoughts that preoccupied his mind as he laid his head on that pillow. We don't often talk about the stigma of asking for help from this context, but it's one of the primary reasons people don't get the help they need. I once heard a quote from a social worker by the name of Sophia Ye. She said, "People show trust in their feet. They show trust walking into places and spaces. I started to learn this very early on in my career at Whistler Community Services, and it didn't come to me in a manual or an online webinar, but instead, a very gentle, kind volunteer who was helping in our food bank. In 2010, our food bank wasn't very busy, but one day something unexpected happened. Our food bank line went from 50 people to 150 people. The closing of the Winter Olympics, the recession in North America, a change in our economy, it all felt like it had hit this mountain town. And despite the increase in numbers, I watched this gentle, kind volunteer work with each person with compassion and care, and take them to their next steps with generosity and kindness. After the shift was over, I approached her and I said, "What's the secret? What's the secret to helping people in that way?" And she looked at me kindly and firmly, and without missing a beat, she said, "Jackie, you need to remember that every person you meet and help, they belong to somebody. They're part of a family." This teaching came full circle in my own life when my oldest son entered kindergarten. One day, doing a clean of his backpack, I found some ice packs. It turns out my son was experiencing bullying on the playground, and whenever he experienced a bruise or pain, he would go to the school administrator's office for help. When I brought those ice packs back, the school administrator was the same kind volunteer who helped us many years prior. I took confidence in knowing that she didn't just see a bruised kid on a playground, that she saw somebody who was part of a family and that he belonged to somebody. The school administrator, she assured me that my son's daily visits to her office would stop. By December, there were no more ice packs in his backpack, and instead he spoke fondly of play dates and birthday parties and all these wonderful support systems. It was just important to know that she recognized that he belonged. I often wonder, what would this world be like if we all came at it from the lens of that gentle, kind volunteer? If we always approached our work with a feeling that everybody belonged to somebody and that everyone deserved to be seen and heard and welcomed. I started this talk today about my dad and how he reached out for medical support. And the doctor said to him, "Look out to that waiting room. There are sicker people than you. You're wasting my time." A few days later, my dad was on a walk with our dog, and he started having trouble breathing. We rushed him to the hospital. When he got there, he was worried that he was a burden, that all the symptoms were in his head. He even apologized to the medical team who triaged his care. But this team, they welcomed him with compassion and kindness, and they assured him that he was exactly where he was meant to be. This time, the medical team was right. My dad's inability to catch his breath was due to blood clots in his lungs. However, they also prepared us that more information was to come. Something much deeper was causing those clots. A few days later, my siblings and I arrived to my dad's hospital room with my mom at his side, and he looked at us and he told us that he had stage 4 pancreatic cancer. and that he had days, maybe months to live. In 2002, the mortality rate for pancreatic cancer was 99%. I can remember feeling this sense of frustration and anger. How did we get here? Why were my dad's symptoms ignored? Why was he judged, mistrusted, or not seen or heard? What did he have to do to earn this help? When I was a kid, my dad would give us the strongest hugs, and he would hold on so tight to the point that as his kids, we had to be the first to let go. With his arms tightly wrapped around us, he'd say 3 things. I'm always with you. I'm always your biggest fan. And most of all, Jackie, thank you for choosing me. I can remember as a kid going, Dad, I don't think I chose you, okay? But I want to believe that my dad, far before he got sick or his life came, or he knew how his life was going to end, that he had this strong intuition how important it was for us to be seen, heard, and perhaps even chosen. What I would not give to be able to look out to this crowd today and see my dad, who would be 75 years old, seated with our family, surrounded by his 3 wild grandsons, stand up and wave until he got my attention. Perhaps my dad, just like that kind volunteer, always knew and reminded us that we should always remember that we all deserve to be seen, heard, and chosen. And most of all, that we don't need to earn our help.